Hello, my name is Robert Brill. I'm a fibromyalgia advocate and PhD candidate in health psychology, and this is my fibromyalgia podcast series. Today I'd like to discuss the drug Neurontin, or also known as Gabapentin, and is it right for fibromyalgia pain. Neurontin is a non-opioid medication suggested to be able to reduce chronic pain, inflammation pain, fatigue, sleep issues, and a number of other symptoms typically seen in fibro. It was originally developed for epilepsy and is commonly used to treat many kinds of neuropathic pain. Neurontin has not been approved by the FDA to treat fibro, but it's being increasingly prescribed by doctors off-label to treat fibro. Neurontin works similarly to Lyrica, but Lyrica is a little bit more potent. Lyrica was also originally developed to treat epilepsy and neuropathic pain. And what it does is it modulates the calcium channels to dampen the excitability of the nerve endings to inhibit the seizure activity. Both medications act to limit the release of pain neurotransmitters from the brain and spinal cord. Neurontin was actually developed to act as a GABA agonist, which means it mimics the neurotransmitter GABA in the brain. Neurontin can be dosed really broadly, between 100 milligrams and on up to 4,600 milligrams and more. Neurontin has opioid-sparing effects, but beyond that, the side effect profile for Neurontin is supposed to be mild, and since the medication is pretty inexpensive, it makes sense that physicians would be prescribing it for a lot of different things. At high doses, Neurontin is known to affect the dopamine receptors, which translates into having a positive psychological effect. This is good news for those of us with fibro who also suffer from depression. It's typically pretty well tolerated, easily titrated, and doesn't really require lab monitoring. And interestingly, according to the physician's desk reference, as the dose increases, the efficacy decreases. It's pretty opposite to most pain relieving drugs. So if you're taking 900 milligrams a day, you're actually benefiting from around 60% of the drug. But at 3,600 milligrams, you're benefiting from only around 33% of the drug. I've talked to many people who've used and still use Neurontin for fibro symptoms. I've heard as much negative probably as I have positive responses. It's difficult to say one way or another if it's right for you, but talk to your doctor about it and see, because it might help. Thank you.